So tell me, Manohar, where are you from?
I'm from Hyderabad.
Hyderabad. Okay, so are you comfortable in English or Telugu or Hindi?
Telugu and English.
Telugu and English. Okay. So just tell me your conditions. First time when you suffered with avascular necrosis. So what you feel at that time?
At first, it was stages both 4 and 5.
Okay.
I was can't even to able to walk and sit and stand. But now it was after the treatment. After coming here, it was too good. I can even able to walk and sit and stand.
Okay. So that was, I think, it was new for you because what's your age right now?
Presently, I was 20.
20. Okay. So at this time, when you just got your avascular necrosis in the hip joint, so what is the situation at that time when you feel there is a AVN and you just go for operation?
It was too bad for me. Cried a lot and felt so guilty that why I'm the one got this problem at this age.
Okay.
After got hope and myself believe that I should need to get cured by treatments Ayurveda, not to go for the surgeries.
Okay. So how did you get this hospital? Means our hospital, our treatment?
After so many reviews and research, I got this by searching by YouTube.
Okay. So then you decide to come to hospital and for treatment purpose. Okay. So it was difficult to just connect this hospital from your place to here.
It was too far from us.
Yeah.
But only should everything need to believe and come to hear that I can cure here.
Correct. So that was the point. I think you came to my hospital. Okay. So what you get here? What you found this hospital means regarding your disease. What you are feeling right now?
Right now it was too good. I'm not even feeling that I'm AVN patient.
Okay, very nice.
Total problem was gone.
Okay.
After just seeing the X-ray past and the new one, two improved. No problem is there.
So after how many days of treatment you feel much better?
Within second I got the
Okay.
good relief.
So just can you tell me your means your moments? What was there first before treatment and after that? What is the change?
At first it was like soothing, limping is so much there.
Okay.
But now there was no soothing. I can even walk. Good relief. Even sit and movements was too good.
Okay. So before that, what was the condition?
Can't even able to sit or stand.
Okay.
Even if I walk, there was too much pain.
All right. All right. So even the painkillers, it was working on your body or not?
No, even painkillers was too heavy.
Okay.
Can't even if I taken the medicine, it will work for 1 day.
Only.
Later it will start again the pain more.
Okay. So from this hospital, if you admitted almost 7 to 8 days treatment, so yeah, hospital give you any type of medications, any painkillers, any injections for you?
No, they will not provide anything. Only the treatment.
Okay.
And good. The staff, everyone will treat us good.
Okay.
They will show respect, everything.
Okay. So what message would you like to convey to the patient who's suffering from AVN in your age, because you are very young right now? So
Only thing was I will spread like only should everyone, even patients need to believe on only one thing. If you are coming to here, believe on one thing that you can cure here. No negative thoughts. Only you should need to think positive.
okay.
Need to believe on one thing. Treatment will be too good. Medications will be good. No injections. No, they will not do any like surgeries or injections.
Any message would you like to convey in your language, because it is I think you are uncomfortable in English, but in your language you can share your feelings to the patient who belongs to your area.
ఎవరైతే ఏవియన్ పేషెంట్స్ ఉన్నారో వాళ్ళు ప్రతి ఒక్కరూ ఒక్క దానిపైన నమ్మకంతో ఉండాలి. ఒకవేళ నొప్పి అందని ఫీలింగ్ ఉంటే దాన్ని మర్చిపోయి ఇక్కడికి రావాలి. ఇక్కడికి వస్తే మీకు చాలా ఉపయోగం ఉంటుంది.
Okay.
మీరు ఇక్కడ టాబ్లెట్స్ ఏమీ ఉండదు. ఓన్లీ ఆయుర్వేద మెడిసిన్స్ ఉంటుంది. ట్రీట్మెంట్ వెరీ గుడ్. ఓన్లీ థెరపీస్ ఉంటాయి. అవి మీకు చాలా కంఫర్ట్ ఇస్తుంది. 8 daysకి మీకు ఇంప్రూవ్మెంట్ అనేది యూ కెన్ సీ దట్.
Okay. So uncle, I think he is your father, huh? So कुछ बोलना चाहेंगे आप अपनी लैंग्वेज में?
తెలుగు.
Yeah, sure.
సార్
कुछ बोलना चाहें तेलुगु में बोलिए.
నాకు నచ్చింది ఏంటంటే సార్, తెలంగాణలో పెద్ద పెద్ద హాస్పిటల్కి వెళ్తే అందరు ఆపరేషన్ అని చెప్పారు. నేను చాలా భయపడ్డాను. తర్వాత తెలిసింది ఏంటంటే యూట్యూబ్లో చూసి వచ్చినాము. 3వ రోజు రిజల్ట్ తెలిసింది. 8వ రోజు పూర్తిగా 50% రిజల్ట్ వచ్చింది 8 రోజుల్లో. నాకు చాలా సంతోషంగా ఉన్నది. లైఫ్ లేదనుకున్నాను, ఈరోజు లైఫ్ ఉందని మొత్తం పూర్తిగా నమ్మినాను. సెకండ్ విజిట్కు టోటల్గా నేను క్యూర్ అయిపోతాను మా బాబుకు. నేను చాలా సంతోషపడుతున్నాను.
Okay, so that was your journey from your Hyderabad to now. I think it was from it was very we can say it is very painful journey, but I think after this treatment you are feeling very well, and I think I am returning your smile again. So because you are very young, so God bless you. First of all, I want to show you about the recent X-rays, because it is not easy to treat Manohar, because it is the first X-ray when I started the treatment. You can see the conditions. That is a degenerative ball in the left hip joint, and in the right it is also, you can see there is a patchy area. But in this X-ray you can see that is a 4th stage avascular necrosis in the left hip joint, and the right it is almost 2nd to 3rd. But in the second X-ray 7/27/5/2022 you can see the change, lots of changes you can see in the X-rays, previous one and the recent one. So there's a ball shape is regular right now, and the space is also regular, and the pelvis, the most important thing, the pelvis is also equal as compared to previous one, that was tilt, but it is in this new X-ray it is looking very nice, and this pelvis is equal, hip are equal. So that is the recent condition and of Manohar. So I want to see Manohar's recent movement. So can you show me?
Are you walking?
Okay, so just firstly tell me your previous condition, what was there previously about the movements?
Can't even able to sit.
Okay.
Can't even able to move like this, tilt, or
Okay.
even can't even get up suddenly rapidly.
All right. So just can you what about your walking? Means it was okay or not?
Walking was can't even to move, like walking style was too different.
Okay, so now you can walk easily?
No, it was
Just show
normal.
me first. Very nice, very nice. Just you can walk fastly, or normally you can walk easily, or just you can walk.
Faster also can be able to easy.
Okay. There is no limping, I think.
No pain.
Okay.
Can
Is there
you-
any pain?
No pain, no, not even 1%.
Okay. So previously you are able to sit on the floor or any other things,
Can't even able to sit on.
but right now,
No, right now it was able.
Okay.
No comfort.
just show me here.
Right now it was planned, so it can somewhat.
Very nice. You are able right now.
Yes.
So during this, I think in last 7 to 8 days, you don't get any type of painkillers.
No.
After that, you are feeling well without any painkillers. So just up. And what about your stair climbing? You are able to climb the stairs right now?
Can resist this.
Okay, easily you can stay.
Easy.
So just go. Just show me first. So we can see the story of Manohar, because I think he is able to do all these things, and because it was very painful when the patient get this avascular necrosis, as Manohar said here. So it is not easy to accept these things, because in young condition, because he is very young, he is just 20 years old, and he just get this vascular necrosis. So the total future and all this aim, dreams just come into towards that. It is totally we can say stuck. just because of that AVN, that disease. And so that was the story of Manohar. So I will just guide to everyone who's suffering from AVN since last many years. But if you are watching this video, so definitely it will help you out, because Manohar is fighting his avascular necrosis. I think he will win after some time if he will follow everything about his disease, and very consciously if he's following everything, so he will feel much better with the disease. And as per my instructions, if he is following all these things, so he will just get rid of this disease. So thank you so much. Keep sharing this video. And one more thing, अगर आप सफ़र कर रहे हैं तो जितनी जल्दी हो सकता है, if the ball is decaying, before decay, just come to our hospital for treatment. Thank you so much.